Hello, everybody, and welcome to another episode of Real Talk for Coaches. I'm your host, Dr. Dawn C. Reid, and as always, I'm so excited to have co-hosting with me Coach Will. And we are here to provide information and conversation, in other words, real talk for coaches and even for coachees, those who are seeking a coach. And the information that we provide should help educate and allow everyone to identify how they want to approach coaching, what they want from coaching, trends, information to help all of us optimize our full potential. So I'm excited, as always, to present information to everyone. And just to be clear, I usually approach real talk for coaches from a coaching lens. Sometimes I put in my own personal experience as a coachee because I've been on both sides. And Coach Will, he has gone through coach training. He's a certified coach. While he does not practice professionally, he does use the coaching toolkits and skill sets, uh, personal life, professional life, and he's going to bring the lens more from a coachee's perspective or those who are aspiring to become a coach. So our energy together is going to help you, no matter where you sit, kind of figure it out. All right, you guys. So, how are you, Will? What's going on? How you doing?
I'm I'm doing all right. What's going on with you? How are things out there?
How's things out here? Things here in Thailand are amazing. As most of, if you follow me on social media, and well, of course, you know, because you and I are in communication. But for those who follow me on social media, I have been in Thailand. I'm immersing myself in the culture. I'm hanging out and talking to people from ICF Bangkok. I'm doing this really to have a more direct personal experience as a coach without borders, and also to develop my digital nomad coaching program. So, yes, so everything here is pretty copacetic. I'm still struggling learning the language, but
Right.
other
Right.
than that, I'm good.
Okay. All right. Everything back here is all right. I mean, sun is still out.
Sun is still out.
You know, sun is still out. It's still crazy here, but hey, you know,
Yeah, I do know. I do know.
yeah,
And since
yeah,
we're not a political show, I'm gonna keep
yeah,
up.
yeah, yeah, yeah. Let's do that.
Let's do that. Okay. Okay. So, this particular episode, we're gonna kind of explore sex coaching versus sex therapy. Um, and as you know, I have the sex and intimacy coaching program where it earns, I think that one earns 23 CCEs. So you get a nice amount of CCEs. And it's a program that's really great for those coaches who are looking to maybe deepen their approach in sex and intimacy coaching. And so we're gonna, talk about the definition of what sex coaching is versus what sex therapy is. We're going to talk about when to seek a therapist over a coach, ethics and boundaries, which is really, really important, very important, and some case examples, right, that I've had in coaching people in this area. And Will, you can ask me any kind of questions. I'll be happy to answer them. And again, I'm probably going to ask you questions more from a coachee or client layperson's view to get your thoughts on it. Like if you went to go hire a coach for this particular topic. You ready to get into this, sir?
Yeah, I'm ready to get into it
All right.
because I'm ready because it was interesting when we talked about this subject behind the scenes. I was like, sex coaching versus sex therapy. Like, I didn't realize there was a difference. I heard of sex therapist,
Yes.
and when I think of a coach, you're gonna laugh at it. They say, go ahead, give it your all, push it out, shove it out, way, and yeah, you don't want to be in a bed with somebody, but so
The visual that you just gave me.
yeah, I'm just saying. I mean, but so. what exactly is the difference between a sex coach and a sex therapist?
Thank you. And it's a perfect question, right? Because what is the difference? So, the biggest, and I'm going to say this in very basic terms, right? The biggest difference is in sex therapy, it's more of a clinical or a treatment approach. There's some type of dysfunction, right? That is keeping you from moving forward. There's a lot of emotional and, in some cases, physical healing that is needed in order to move forward. Coaching is non clinical. While coaching is therapeutic, coaching might have goals. Coaching may have role playing. Coaching might have certain aspects that is not treatment, but it's more about action and mindset and helping the person move forward or understand their current or present condition. But again, it's non clinical. And that's the biggest thing that people need to understand. We're not here to fix anyone, but we are here to help people figure out what they want to do and how they can move forward.
Okay, all right, that makes sense. It's this seems like it's a very thin line there between the coaching part of it and the therapy. Well, yeah, it's always a thin line, I think,
There's
but
always a thin line.
yeah, yeah,
And the line that's drawn is clinical. Is this treatment or not? Is there a dysfunction, a clinical dysfunction or not?
okay,
Right?
okay,
If I were to give an example, if someone has been um and they have PTSD. Well, PTSD is a clinical
yeah.
term.
So that would be
That would
more
be
therapist
therapy.
than coaching.
Exactly. However, a couple who's like, look, we've been married for 10 years. It's not spicy anymore. Things are boring. We're
Yeah.
looking for ways to spice things up, right? And so coaching would be ideal because then we can talk about how do you have the conversation about it? Or maybe you're not getting what you need in the bedroom. How do we have a conversation about it? Right? What are the goals that you want to achieve? Do you want to spice things up? Do you want to communicate better? Do you want to use toys and you're scared to talk about it? Like that's where coaching could be ideal over therapy.
Mhm. Okay, okay. So have you ever had like a scenario person where you're dealing with a client and it's like, yeah, I think you need to see more of a therapist than a coach, um, without revealing,
Oh, absolutely. Not to reveal anything because I would never put my client's business out there, but certain topics that have come up in the coaching session, incest, right? So that's definitely not
yeah, definitely.
that's not a coaching situation. Um, Sexual assault, again, not a coaching situation, right?
Mhm.
Um, those were kind of like, yeah, those particular areas. Actually, I did have a client a while back. This is a while back. Um, what she was taught about sex, is bad, don't do it, right? Um, when she finally got married, and now, of course, you can have sex, she's like, but it's bad. So she couldn't
Um,
wrap her
so she
mind.
carried that wisdom.
Exactly. Exactly.
Yeah.
Now, the beautiful part about that particular situation, from a coaching lens, I was still able to work with her, but she also worked with a therapist, right?
I was gonna
Mhm.
ask you that. Are there cases to where you may have someone work with you and the therapist at
Yes.
the same time on the same thing?
Absolutely. 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 Positively. And so my goal is to reinforce mindset and particular goals and to kind of give the psychological space to start to experiment with thoughts, with feelings, with conversations, with baby steps and saying, okay, what's a baby step? You got your therapist, you got me. How can we work together to help you with those baby steps that you need toward mind shifting, and achieving an outcome that you want to achieve, right? But I'll say that most of my clients tend to be married couples, married couples. I get a lot of clients that are interested in the BDSM area. I get clients that are interested in polyamorous type of relationships. I have people who they come to me, they want to date again after a divorce, or I have had couples also, and this is something that is important to me and I'm actually going to be doing some research on it a little bit more, is menopause. Like there's a whole genre, maybe I'll even do a whole segment on this. There's a whole segment of people, women my age, between the ages of 40 and 55, you're going through menopause or you're through menopause, right? And how do you have a conversation with your spouse, your partner about your libido because there's a lot of things that they don't tell us, unfortunately, about what happens to you mentally, physically, where you are in your life, what happens to your body, right? They don't really talk about it. And so a lot of women get really, really confused at what's wrong with me and why don't I want to have sex and how do I
Right.
get the spark back? So I have clients on those in those areas, again, because it's non-clinical and we can work and use coaching tools and approaches to help them get their groove back, as they say.
Okay. So now that brings me to, I know you said most of your clients are couples and things, you know.
Mhm.
So have you ever had it to where um a client has overstepped, meaning has said something inappropriate to you?
Oh,
Like,
yes.
oh, this, and how do you handle that? As a, you know, as a coach, you know, how do you handle that?
Well, one, I really think, well, my belief is that this person really wasn't serious. I think it was kind of like a prank call, or either they had some other underlying issues, right? So I do want to preface it. But again, I still handled it with what I feel was very respectful. So I had someone call, they did an introductory call. And he said that he was in the adult film industry. No problem. He told me what his challenges were. And it sounded like it made sense in the beginning, right? And I even was going, might be that thin line. So I want to make sure. And so his challenge was he's in the adult entertainment industry, but he's finding it difficult to be intimate with his partner. So on the surface, I'm like, okay, let's see where this
Makes sense.
goes. Let's see if it's clinical. And so as we started talking, then I noticed he started to get more perverse. And he would say things like, I'm gonna use the nice word, but he didn't say this
Yeah,
word. He said something vulgar. you know,
yeah.
I'm having a hard time climaxing. And I'm like, okay. So, and I said, well, do you feel that therapy would be a better match for you? Or do you feel like coaching? Like, is this something? No, no, no. I'm definitely, there's nothing, wrong with me. It's just, I'm trying to make sure that I'm doing right by my partner. I said, okay. So then it just started getting much more vulgar after that. Cause then he was like, oh, now I'm erect. Oh, now I think I
Oh,
can
so we're
do X,
going
Y,
left.
and Z. Exactly. And I said, you know what? Let me stop you there because you're crossing a line. And I explained to
Right.
him, I have no judgment about what you're doing. I'm more than happy to work with you if you're serious about coaching. But it sounds more to me like this is a prank call. No, 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 no. I promise you it's not. But then he kept getting vulgar and saying terminology that crossed the line for me. So I was like, I don't think I'm the coach for you. I said, you might want to go to therapy. That's my recommendation. Or you might want to seek another coach that's more willing to adjust to your style. I said, I don't think that we would be a good fit. Yeah. And that's how I handled it.
And that's good. 'Cause that's like setting up a boundary. Like, hey, this is no, you're going too far. This is where
Exactly.
it's at. And I would
Exactly.
figure, um, because I know how the male species can be at times. I would figure that sometimes they would make inappropriate comments just to see if you're going to bite,
What you're gonna
just to
exact.
see if you're going to like, oh, okay, let me just throw that out there and see
Mm-hmm.
where she's at.
Mm-hmm.
Um,
Mm-hmm.
because while everybody may be coming for coaching or therapy, some people still in the back of their mind still like, you know what, I'm still going to try this to see how far I can get.
And that's kind of what I sensed in that session was there was testing how far can I go. And it just got worse and worse and worse. And I was like, yeah, no, we're not doing this. I'm not doing this. I'm like, yeah, I'm hanging up now. We're done. You do have to be careful. There are boundaries. I know, like, I'm an open book. I want my clients to feel comfortable and talk to me about anything that's occurring for them. But at the same time, I also feel it's important that you have boundaries and don't cross those boundaries as a coach. And these are things that you can also set the agreement with, especially with this type of topic, because it is sensitive. And like you said, there could be a client who they want to test how far they can take the conversation.
Right?
Mm-hmm.
Right. Okay, so I just have one more. Well, not one more
Sure.
question, but I want to go back to the whole thing of person working with a therapist and a coach. So in that case, most stuff is confidential and things of that nature.
Mm-hmm.
But if somebody is working with a coach, let's say you say you come to me and you say, hey, well, you know what? You may need a therapist as well as working with me. Will you be the person that will refer the therapist? And do you like, will you also be the one to work with the therapist as well? Well, like, because I know a lot of that, well, if you're getting into the thin line of uh, private information, but being that you have told this person, hey, you may need to see a therapist as well. You
Mm-hmm.
know, we could both work together on helping you. How much is that like, okay, you know what? Yeah, let me talk to your therapist and compare notes. Or is that ever a thing?
Well, that's a two-pronged question, right? Because it's really a case by case situation, to be honest with you. It's case by case. So, for example, so far, I haven't had to talk to anybody's therapist directly. So that's A. However, if they wanted that we would sign, a permission in order to share information, right? And to order to share and talk to the therapist, and can definitely do like quick emails and things like that. So, are we open to it? Can we do it? Yes. If everybody's in agreement and we sign all the appropriate documentation, absolutely. But for the most part, it's I don't necessarily say here, go to this therapist, right? It's more check your benefits to see if you can locate a therapist. Or if I'm working with a particular platform that's like an EAP or a benefits hotline, I might say, check to see if there's a therapist through this platform that can work with you. Um, or I'll say, hey, this might be a topic for you and your therapist. You know, if you feel like debriefing me about how it went and what they said, I'm open to listen. But at the end of the day, that's kind of the extent of what that would look like. So I make the recommendation, they choose to go or not. So far, communicating with the coachee or the client, they are the ones that's responsible for talking with their therapist and sharing information between us, if that makes sense.
Right, right, right. Because me, I think like looking into that, I would probably be an oversharer if I had to. Like, 'cause I would probably come back to you. Well, my therapist said X, Y, and Z, and how do you feel about that? Oh yeah,
Interesting.
and did, you
Yeah,
know,
I've gotten that.
I,
Yeah, I've gotten that. And so, and thank you for bringing that up because don't get me wrong, not just in sex and intimacy, but even in other areas where people are talking to their therapists, right? And sometimes there's a difference of view. And I always tell a client, I'm always going to share it from a coaching lens. Your therapist is giving you information from a therapist lens. We're seeing the situation in different ways. You are there for treatment. And if you feel that that path works for your treatment, you listen to where you feel you're going to get the treatment benefit. I'm not here to treat you. So if this is part of your treatment, go with your treatment. Now, if this is more of preference, if this is more your beliefs and values, if you feel like this is more you'd rather see it through a coaching lens because it's not really impactful from a therapeutic lens, that is totally up to you as the client. So usually I preface it as, is this therapy? If is this part of your treatment? Or are you free to decide how you want to approach this? And I leave it up to my clients to do what they feel like. So now I've got some questions for you, right? And so I'm
Yeah,
just curious, what would open you up to go to a sex therapist? Like, what would you seek a sex, not therapist, I'm sorry. What would you seek a sex coach for? Any thoughts or?
I would think maybe uh, if I had problems connecting with my mate on an intimate level, I think I would probably like now since I know the difference, since you explained the difference, I would probably like, okay, you know what, maybe we need to see a coach about this. If we're on two different things, like I may like, see, I don't know if that's because see where I may like something and she wouldn't.
Right.
She doesn't like something, so I may, you know, take that route then.
Okay.
As far as trying to figure out, like trying to find a happy medium between the both of us,
Okay. I think that's
you
fair.
know.
And in looking for a sex and intimacy coach, what would you look for? Like, what would be some really important traits that you want in a coach?
So I would, you know, my personal preference would more than likely be, you know, African American,
Okay.
African American. Um, I think it would, you know, and this is going to sound, this is, for lack of a better word, not this, not sexist, but
You'd want a
uh,
man. You
what's
want a
it?
male coach.
No, actually, I
Oh,
wouldn't.
okay. I jumped the gun.
Actually,
I'm
I
sorry.
wouldn't.
I'm sorry.
See, I was trying to think of the word, but actually, I would rather have a woman coach
Interesting.
because the male ego is very fragile,
Mm.
and to be to discuss sexual things in front of another man, that's like, God, like they may be looking at me some kind of way,
So you feel like they
you
would judge
know.
you?
Yeah, yeah, yeah,
Okay. Well,
yes.
no, thank you for being honest because
Um,
there may be other people out there that feel that way. So yeah.
yeah. And I'm pretty sure something like this is probably heavier with men than it is with women because I know women are more open to communicate with other women than men are. It's certain things I'm not going to just say it, you know, to another man just because it's a man and in the back of my head mentally, even though he's not supposed to, you know, as a man, I may feel like this guy is judging me, like, you know, and I think a lot of men go through that.
You know what?
So
In all honesty, I think that's fair. I think that's fair. And I this is kind of putting me a little bit in line of my research work in help seeking behavior, right? And one of the things that was very interesting is that men are least likely to seek help over women. Now, everybody, for the most part, is least likely to go get help. But men tend to be the larger demographic that don't want to seek help for many different reasons that I outlined in my study. Um, and so I'm laughing because I already see the connection and correlation. And again, I understand that there are certain cultural beliefs, social beliefs, self beliefs, family beliefs that has taught men and women, you don't talk about sex. Sex is a taboo. And I do find that those who do seek out sex and intimacy coaching, they really want to talk about it. They're like finally ready to talk about it. And I do find
Yeah.
that people struggle, men and women, but men in particular, with it. The one thing I will share with listeners who are seeking a sex and intimacy coach is that if you are professionally trained, like I'm professionally trained through the ICF, my program is ICF accredited. So I take the competencies and the ethics really strongly. Like I live it, I breathe it, I believe in it. And one of the things that I can say, at least if the person is ICF credentialed, there is no judgment. Like we don't come in, and I know quite a few male coaches who are amazing. We don't go in as coaches having any kind of preconceived thoughts because remember, part of our development is working through our own biases, our own beliefs, our own values, and all that good stuff. So the longer you coach, the more experience you have, the more you're self aware around how you judge, when you judge, why you judge. And you've been actively working on that. This is why I'm big on continue coach development. So I say all that to say I'm glad you brought it up because I do believe that other men in particular will feel that way. But I want people to know that you are least likely to be judged in any way. It really is not about us as the coach or our feelings and our belief. It really is about you. So I hope that might help. But anyway, so
Yeah, yeah, it will. I
yeah,
mean, but I think, um, okay, I think as just as a male, especially a black male, there is a block to revealing certain things to
sure.
other men. It's just it's the male ego. It's the
It
whole
is.
male ego,
It is.
and you don't want a lot of men don't go to therapy. Not even talking about sex therapy, sex coaching or therapy. A lot of African American black men, men of color, don't go to therapy because they don't want to appear weak.
Weak.
You know, they think, oh, and then bring up a topic of sex, then it's like, oh,
Your manhood.
definitely don't want to appear weak. But I don't think they realize that they're going through it's you have to be strong to go through this. Like you're not weak by going through this. Actually, you're probably stronger by saying, hey, I need help here, or
Yeah.
can you, um, help me through this? That is actually stronger than just keeping it to yourself.
Agreed. Agreed.
You know,
Unfortunately, we've hit the end time. I can't believe it. This conversation went quick. Is there anything that you'd want to close out with, or any final thoughts that you want to share?
I think as we stated in the last part of it, it's not it's to go through any type of therapy. But we were talking about sex therapy. It doesn't make you weak.
No.
You just have to figure out what you need in a therapist. Like
What
write it down if
coaching,
you have to.
coaching.
Coaching. I'm sorry. What you need is a coach as a coach. Write it down if you have to, and then when you go through look in your coaching thing, check off that box. Like this person has this. Okay, this person has that. This person has X, Y, and Z. That's what I'll leave off as.
Okay. And thank you for sharing that. And I think it is important, have hearing somebody else say it from a layman or coachy perspective. I think is really helpful because you're probably going to be in line with how other people might be thinking, right? And I think that's important. And I think I'll share for coaches is just be open and make sure you have to assess, and you could there's assessments out there to see if it's clinical. You can also create your own assessment, but make sure you assess that this is a coaching lens versus a therapy lens, because there could be some trauma or triggers or something that's outside of the scope of coaching. So I do think as coaches, we got to do a really good job at assessing to make sure we don't cross the coach therapy line and that we stay in our lane. I think the other thing is this is a sensitive topic. And I think that it's going to be important for the coach to hold a lot of space for the coachee to feel psychologically safe. To your point, this is an area where it's taboo. You don't talk about sex, you don't talk about challenges in sex, but people have challenges in sex. So we need to talk about it. And so I think just being mindful that we have to take into account cultural responsiveness, which we're going to be doing an episode on that. So please make sure you guys stay tuned. And you have to also know how to push, because this is such a sensitive topic. So that's the information I would give to coaches. Oh my gosh, as always, this is fun. Did you have fun with this conversation?
Yes, I did. We always need more time with these.
I know, I know. But see, video editing is my video editor, Kyla. She gonna kill me because she's like, it's too long. I'm like, I know. So I have to be very mindful that I can't go overboard. Plus, we don't want to kind of do anything that's going to mess up the algorithms for social media. So,
Right.
anywho, so we're going to end here. But if you guys want us to do a part two, we are happy to do a part two. We'll talk further. We'll bring other topics in it. And yeah, check out my sex and intimacy coaching certification class, which is starting this month. So this time to sign up for it. Ooh. And we will see you guys in the next episode.